Hello, welcome today to the talk on clinical engagement called Following the Energy. Just for introductions, my name's Dr. David Farlow, Executive Director of Research and Innovation for Mackay Hospital and Health Service and Clinical Dean for the Mackay School. Welcome.
My name is Bauke, Hovinga. I'm the Clinical Director for the Emergency Department.
Look, today's really at two levels, so to speak. It's at senior executive level, board level, and then more importantly, on the floor. What happens on the floor is critical to patient care. However, for anything to occur on the floor, we need to establish that clinical engagement. So today's about establishing that clinical engagement and also some mention on how we're moving towards consumer engagement. I'm not sure about your organisation that you work for, but certainly in ours, it's what I call STP, same 10 people. You're looking for somebody to do something, you usually find the busiest person who's passionate about what they do. And it really is time that we do try and share the load. I like to call this following the energy because what we're doing is really putting out, finding where each individual clinical unit has the energy. It's not necessarily the clinical director, it's not necessarily the nursing director, it is the person who's actually an influencer on the floor. And so in today's case with Bauke, he's the director of the emergency department and just so happens to be passionate and also a major influencer for the behaviour on the floor. We like to use the word tribes because in fact that's how we work. And so rather than try and do an approach from board to executive and then try and do what I call shotgun approach to penetrate across the organisation, you really need to deal with the influencer or clinical director who then influences their area. In our case, we're building slowly our research tribes, and the ones that are listed here: emergency, pathology, radiology, rural, general medical, anaesthetics, medical education and renal. Captures most of the departments and more are coming on board. And this is it in a nutshell. So in this case, imagine the emergency department, it's Bauke at the front and all of his staff following along. This slide could have been at the start, but it emphasises if you really want to introduce clinical engagement to influence change, choosing wisely is really a generic term for doing the right thing, choosing the right drug, choosing the right x-ray, choosing the right clinical pathway. And just at a recent meeting at the board, emphasise that unless the board and the CEO in your organisation support the concept, then it's really difficult for anything to occur. So culture starts at the top and then flows through the rest of the organisation. Obviously, there are more things that contribute to clinical engagement and choosing wisely. Digital support is critical. In the days of paper, it's very, very difficult to gain evidence-based approaches, and we're now seeing an exponential growth globally of evidence-based initiatives to use. And this is really just an extension of the previous slide, but formalising it in terms of the principles. It has to be health profession led. It's not a doctor thing or a nurse thing or an allied health, it's actually a professional leader who's got the energy to take this on. It's all about improving quality of care, definitely patient focus. I think sometimes we lose track of the fact that why we're here, we're really the servants of the patient. And so our job is to do the best by them by choosing wisely. Multidisciplinary, doctors, nurses, allied health, support staff can't do it by themselves. It's a tribe that makes the team. And transparency. Today, people have access to Dr. Google. More often than not, they've done the research, and at the end of the day, it's very simple. You're open and honest about the choices that they have. We need to increasingly engage the consumers to take ownership of their own healthcare, and we're there for support and advice. I'll just hand over to Bauke, and we will move on to really what happens on the floor.
Yes, thank you. Yes, it is very important to have the consumers engaged in their healthcare, and you really want them to talk to the medical professionals, nursing staff, doctors, anyone. So it is really important to have those doctors and nurses first on board. In order to do that, to see if we could implement the project and have a degree of success there, we first wanted to find out, are they actually willing to change? Do they recognize that there's a problem? And that's what we did with our initial survey. So we asked them, how often do your colleagues actually request unnecessary tests? Interesting to see that, you can see it on the right hand side, that practically everybody thought that it happens every day or at least several times a week. Having identified the problem, then I think it's important to find out, are the health professionals, do they believe that they have a responsibility to reduce inappropriate blood tests? And it appeared to be that most of them definitely think they do have a responsibility in that. So I guess this showed to us that the time was right to actually implement the project, which we then did. So initially we just started in the emergency department. Our initial project was very much focused on pathology tests. So we look at the CAP, the coagulations, and unnecessary urine culture results. We really wanted to make it easy to do the right thing and difficult to do the wrong thing. So we developed all kind of targeted education sessions. We optimized our digital workflows. We adapted the matrix that already was developed by the Asymmetric College of Pathologists, just to really make it easy to do the right thing. We had great outcomes from this project. We just focusing on those 3 tests, we saved more than $70,000 over the whole year. This was very much an ED-based project, and with that success we thought we probably can expand that. So that's when we went on to radiology. So now we actually involve the emergency department as well as the radiology department. So we focused on reducing unnecessary tests, but also improving the quality of the referrals. Again, we used the same strategies by targeted education sessions and giving people the guidelines how to request. So we based that on clinical decision rules. We were quite successful in reducing unnecessary ankle x-rays, unnecessary CTPAs, and the very good thing was as well that our quality of requesting improved, and because of that the quality of reporting improved dramatically as well. We built it further out to the rest of the hospital. So this is now a hospital-wide project, the pharmacy project, very much aimed at rational prescribing. So looking at de-prescribing, making sure we give medications for the right indications. So after we determined that our health professionals were ready to change and did change, that's when we started to engage more of our consumers. We did a survey, and it was very encouraging to see that 95% of our consumers take an active role in improving their own health. 75% believe that they have sufficient information to manage their own health, and good to see that 88% felt comfortable to ask their health professionals, or their doctor or medical specialist, any questions about any test that we recommend. Almost 90% trust the doctor's opinion about the test that they needed. And I'll hand back to you, David.
I'd like to thank everybody who's taken the time to review this short podcast. But I'll leave you just with one extra thought. It's one thing having passionate clinicians, passionate tribes do this in already pressured departments. So you're asking them to do something that the bureaucrats think should just happen naturally. But it does take time to sit back, keep up to date, and as an organisation, increase the quality. What we're trying to move towards is a reward for good behaviour, so to speak, and we're in the process of returning some funds into the tribal area that they can spend a percentage of the gains that are made. It's not just about money, but just some recognition so that those tribes can purchase things that they can reinvest in either the staff or patients. Thank you very much.